So, Mary, tell me about who your organisation, Domesti-PUPS, is all about, and tell me about seizure response dogs.
Perfect. Domesti-PUPS has a lot of programs under the umbrella, but we're here specifically for the seizure response and seizure alert. Our organizations, what we do is we train the service dogs. We've started a breeding program. So some of them start when they're 2 days old, and then they go into the women's prison, and they potty train them and teach them basic obedience. Then they come out and they go out in the home. We're always evaluating them as it's going on. What does the dog like to do? Are they scent driven? I mean, what is it that really motivates these dogs? And then when they're about a year to a year and a half, we put them into the men's prison, and that's where the formal advanced service dog training begins. What we do behind the scenes then, we're interviewing recipients, and what we do is we have brochures. We ask them to go online, they fill out their situation, what types of seizures they have, then we Skype with them, and so we introduce ourselves, we learn about them, we make sure that we can fulfill what they need with what we have, and then we continue our relationship with them. We ask them to send us videos of their seizures. We have learned through time that it's really important we understand. For example, a terror seizure is something that's very unique and it's very scary. If you've never seen one, the person looks like they're scared and they make those sounds, they look like they're scared, and if a dog has never seen that and the first time you're out in public and they have a terror seizure, the dog is like, oh my goodness, I don't know what's going to eat us, but obviously something's going to. So we want the dog to understand the type of seizure the person has. So we do that based on the video. Then we start duplicating that. We also ask them to give a scent. If they have had a seizure, they swab their mouth so that we can take that scent and use that as well. And then at the end of training, when we bring the recipients to Nebraska, we are there for 13 days. We put them in a hotel and they learn to bond with their dog and they learn how to utilize their dog. So we go to the park, the movies, restaurants, we go to the malls. It's called life, and we want to duplicate that. So they're doing that, they're learning how to use their dog. There's trainers there to help them. We work on seizures and what do those seizures look like. They have to practice and the dog does what it's supposed to do, and then they go home hopefully as a trained team.
So for me, as a person with epilepsy, why would I need a seizure dog? What's the main reason?
There's several. The main reason is when you walk into a room, there's no doubt that there's something going on with this person because they have a service dog. Epilepsy is an invisible. It's invisible. People don't know that you have epilepsy when you walk into a room. You walk into a room with a dog, they know you have something. And so if you go down on the ground, they get it. They know. It's not that this person's been drinking, or if you're walking funny, you've not been drinking, you're not doing drugs. You have an issue going on. So the dog is going to do that first and foremost. The second thing is that it will help you. So if you need the dog to push you on your side so you don't choke, the dog's going to do that. The dog knows what to do without somebody telling it. So it's going to make you safe until you can get help. So that's really what the dog does. Number one, if you're in the home, it's also going to like ring a bell to notify the family. We got a problem, come check it out. And he's going to do his thing to keep you safe until someone gets there. But truly, it's to keep you safe. It's to take away that invisibility if you wanted to. If you don't, then a service dog's not for you because that's what it does. But then it's also a best friend. You can feel safe. You know you're never alone. No matter where you are or what you're doing, it's going to give you independence. And I think that's probably the number one thing people ask is, can I have some independence?
And lastly, what brings you to Epilepsy Awareness Day? Why are you here personally?
This is my passion. It probably can make me cry. I've been doing this for 10 years, and I've seen what these dogs do for people and how they save their lives. I feel that there is so much information in this one location that this, to me, I wish everybody that had epilepsy could come and learn what there's out there. Service dog is one piece of it, but it's not everything. So that's why I'm here. I want to be a part of that because there's not one answer. There's lots of answers. And so I hope that I help in that area.